Today, we're diving into the fascinating world of mobility, injury prevention, and the hidden dangers lurking in everyday products. Curious about the myths behind one dose fits all in medication? Or perhaps you're concerned about the synthetic preservatives in your favorite snacks and cosmetics. Join us as we unravel these mysteries with our special guest, Dr. Laura Kummerle. Learn how to enhance your movement diet, navigate the pitfalls of synthetic preservatives, and challenge the age-old myths.
The Discovery Doc Podcast, where your journey to empowered, non-toxic living begins. Join me, Dr. Cece, a doctor of nursing practice, self-proclaimed Toxin Tamer, and mama of four, alongside
me, Anna Kate, your medical mystery overachiever. Together, we'll uncover the latest in functional medicine, debunk health myths, tame toxins, and provide practical tips for thriving in a modern world.
Get ready to take control of your health with expert insights, raw stories, and actionable wellness strategies designed to help you and your family lead vibrant, toxin-free lives.
Let's discover together. Welcome to the Discovery Doc Podcast. And we are here this month with Laura Kummerle. Did I say it right?
Yep. Yeah.
It's been a word day for sure already. She is joining us all month long, so make sure that you join us for every episode as we continue this conversation. And would you like to tell us about Laura?
Yes, Miss Laura is a doctor of physical therapy who specializes in all things, and I mean all things movement, whether that's mobility to workouts to education and everything in between. We're so excited to have you on. Welcome to our show. Would you please give just a little introduction? How did you get to be Laura? What brought you here?
Yeah, so first, thank you so much for having me. I'm super excited for this conversation. Basically, long story short, grew up doing gymnastics, found a passion through movement that way, decided on going to physical therapy school just because I really was interested in how the human body moved. And then just slowly progressed from there, realized after I retired from gymnastics, something was missing, and that's kind of when I discovered calisthenics and started that movement journey. And so it's really just finding something that you enjoy doing and incorporating it in movement basically to improve your quality of life. That's kind of how I've come to be. So just applying those things to life, career, movement, all of the things.
Yes. Okay. I have to ask. This is not part of our outline, but I have to ask. So going rogue from the get-go. So gymnastics, you said you were a gymnast. My 8-year-old, very near and dear to my heart. She's a gymnast. She's only 8. She's level 5 currently, probably leveling up to level 6. And I'm already like seeing kind of hyper extension in her lower back. Is there, again, going rogue, but for our moms who have little gymnasts, is there anything you going through it that you would say apply at an early age to protect their bodies, or that you wish that you had known or done differently to prolong kind of the longevity of you physically as a gymnast?
So overall, I was fairly lucky and I didn't get injured a whole lot, like just a couple of broken bones, etc. Nothing super crazy. Compared to other teammates. I would say the strength training component is super important because drilling different skills day in, day out, that can wear and tear, and doing the repetitive extension through the low back, common thing for spondylolisthesis and things like that in gymnasts. Basically, that's a specific type of back fracture because of that repetitive extension. So reducing that risk is going to be basically distributing the forces elsewhere as well. So if you notice maybe you're hinging at one specific spot in the back, maybe it's the low back, but like in a bridge, for example, you're not really getting like over the shoulders, like your shoulders over your hands a whole lot. Maybe working on that shoulder motion is going to help reduce some of the stress on the low back. And even looking at the hips, making sure you have enough hip extension to reduce the stress on that low back and help with that curve to better distribute the force. So it's really looking at those movement patterns and making sure you're moving well overall from a mobility standpoint and also have the strength in those end ranges. Because if you are more hypermobile, then you do want to make sure that you are strengthening and have the proprioception, basically like knowing where your body is in space. So it's really addressing those things to be a balanced athlete to reduce the injury risk.
Right. Makes all the sense. If we bring it out of gymnastics and just talk about the importance of functional movement and mobility, what in just broad, I know this is such a large question, but in just everyday life, what to you is the importance of functional mobility?
Improving quality of life, doing the things that you want to do, and reducing the risk of injury. So you can do that. So you can do that for longer, basically. That's probably the best answer from a broad standpoint.
Do you see a lot of injuries or common injuries due to kind of lack of that proper mechanics in everyday life?
So overall, from a population standpoint, back, neck, spine injuries are probably the most common, I guess. Granted, you're going to see a lot of different things depending person to person, and it's more because life biases a certain movement pattern, and we don't move to get out of that movement pattern. So it's basically kind of like similar to your diet. Nutritionally, you want to have a movement diet as well. So if you're sitting for prolonged periods, or potentially like you're breastfeeding and your shoulders rounded forward, you're holding, you know, your kid in front of you, you want to get out of that position and counteract that with different movement. So it's really the lack of movement diet contributing to whatever injury you might get depending on the demands of your life.
Yeah.
So I have a question. Why don't we train for life movements? We train for sport movements, or we train for weightlifting, and there's a proper form to weightlift, but that's not how we live life. Like, we don't do a bent over row to pick something up with, you know, slightly bent knees and a flat back. Like, nobody picks anything up like that. Why don't we train for life movements more than
And apply them to
Yes.
athletic movements.
Right.
Right. And
Why
so-
is it the other way?
So I think having a foundation of quote unquote proper movement, so like lifting with the flat back and things like that, is going to help create a foundation. And then once you learn the rules, you can learn to break the rules. So for example, starting out with just learning how to hinge the hips properly in a deadlift is going to help you create a good base of strength. And then potentially progressing eventually towards like a Jefferson curl, which is where you round down slowly and flex the spine, can help you build strength in those different ranges so you can be more prepared for life. And you're not necessarily always going to be, again, lifting with the back flat, because sometimes the object doesn't work. Maybe you're chasing after your kid and like, it's just, you get down there the fastest way that you can. But you want to be prepared for those things. So you want to learn the movement patterns first and then learn to break them, just because you want to have those foundational movement patterns.
I feel like that comes down to an educational standpoint, literally from PE. Like, why in school, you know, in PE, I get it needs to be fun and play kickball. And like, I love those. You guys remember those little scooters that like you ran your fingers over all the time?
I busted fingers.
Yes. And like playing dodgeball and whatever, like it's so fun, but where are the fundamentals too? I feel like if we just spent a little more time teaching the fundamentals to kids, we would save so much in terms of injuries later on, whether it's athletics or everyday life. Like, and I was telling Laura this, I mean, when I threw out my back a couple months ago, and was literally, I'd never go to the hospital, haven't been to the hospital in years, but it sent me to the hospital. It's because I bent over the crib to pick up Jace out of the crib and my legs were straight. I wasn't thinking, I just went down, and I was like very close postpartum. So the laxicity there of my ligaments and tendons is much higher than, you know, if I'm farther postpartum. And it just, my disc slipped right out. And I was like, that's just mechanical. Like, that is just a mechanical error that led to months worth of injury. And it's so avoidable.
Well, and also we don't transition from being a kid that plays into an adult athlete. And I think that is, but she's pointing. If you can't see, watch this on YouTube, because she's up here pointing.
Too.
She's pointing at me. She's agreeing.
Is she calling us out?
No, I said something good.
No, I was going to go with basically, if you think about it, if you look at a kid, they're in a deep squat. Like, they're squatting down like no issues, heels are down, sitting up tall. But then somehow along the way, and somewhere along the way, we lose the exploration of those movements in daily life. And I think that's where like the lack of something is happening, is we just stop moving in those ways. And even as we like apply that from kid to adult, and then even adults to older adult, we stop moving around and can contribute. It's like, oh, it's not necessarily like it's a normal part of aging to, you know, not be able to get up off the ground. It's because we stopped doing that somewhere along the way.
Mhm.
I think that's part of the thing. Like, obviously, you're going to have different life stages and things like that. Obviously, the pregnancy being postpartum, the laxity, and all of that stuff is going to play a role. And then you need to ease back into those things safely and appropriately as you build back the strength.
Right.
But we need to continue doing things that we did as kids.
Yes, 100%, because it does relate to everybody. It's not, we have an extreme example in our family because my husband, he just retired, but he was a professional athlete. So his movements are so intentional all the time because he's trained his body to do that. And so whether he's lifting, deadlifting 450 pounds or picking up our kids, it's with proper mechanics. Whereas I was, even being an athlete in college, I never paid attention to it. Like, I feel like even though I was an athlete, I just kind of skated by and like did the bare minimums and didn't kind of really have the educational aspect of like, hey, and even though I was in school, like I started my degree in kinesiology, and I'm like, and only then did like lights start to turn on a little bit. And I'm like, wait, I went through all of high school, like playing soccer at a high level and just throwing my body around. And it's lack of also, I think big is control of your body and body awareness. I think has a lot to do with that too. And I think we could really help kids with that. And extreme examples are Jackson and Ava. Ava's body control is wild because of gymnastics. Like, that girl, she could do a handstand walk on a cliff. Like, not that I would ever do that, guys, don't panic.
But she has the skill set.
But she has that body control. And then my son is tripping over his own feet. And I'm like, and we're trying, like, he wasn't into gymnastics, which I think is a great kind of baseline, but we're trying to like get him into wrestling and different things, just body mechanics, but it's just not taught. I wish it was, because it does truly apply to everybody. I mean, traveling, like when I'm traveling and I have 4 bags of my kids across my body and then 1 on my hip.
Yeah. And so she's over here sitting crisscross applesauce, and I cannot I can't.
And she has her feet flat on the floor.
I have my feet on the floor because
I'm also sitting on the ground, so crisscross. So, I mean, that's definitely, like, we stopped doing those things. When we're kids, we sit on the ground all of the time. Other cultures also sit on the ground. They squat a lot more than we do as Americans. And like, so where are we stopping doing those things? And why is it like, I mean, most likely it's probably because we're not doing those things that we stiffen up and things like that. So including that, whether it's in our workout or in our daily life, we can definitely include those things.
I have a funny story before I deep dive questions. So I was in, I believe, Cambodia, and we were at some ruins, and the bathrooms were just, I mean, it was like a mud hut with a hole in the ground, and the hole's small, right? It's not massive. And I'm like staring at this hole, and I'm like, how is this gonna work? How am I gonna do this? Actually, like someone else, it was when I was in college, and another girl was like, no, you squat. And I was like, what do you mean I squat? Like, my squat is like at that point I was like doing CrossFit and whatever, and I was like, my squat was a normal like back squat. Like, I wasn't thinking about how babies squat. I can't even do that. My Achilles won't let me to squat down like that. It was and I'm like, what do you mean? What do you mean? And you're right. It's culturally like, no problem. Just go in there, squat on the ground, go to the bathroom. And the shape that you create then in that position for your bowel movement,
it opens up your colon.
Right. Like, it's the
squatty
shape
potty
you're supposed to be in. Exactly.
It's the squatty potty.
Yeah.
It was such a like just light bulb. I was like, holy moly, I can't squat like this anymore. Like, when did this happen?
I can't do it because of my my
joint stuff,
lupus and all of that stuff, which is why I can't sit
joint stuff.
Yeah, which is why I can't sit cross-legged anymore. And I want to. It's one of those skills that I want to be able to do. But for those of you that have a chronic illness like me, don't get frustrated. Just keep moving, and Dr. Laura will tell us all of the things in our upcoming episode how to do that safely and get that mobility back. But are you ready for our deep dive?
Deep dive.
Okay,
so
we got a couple of questions.
We do. We have some deep dive questions for our discoverers over here. So, what is your favorite singular tip that can help anyone in their daily life? So it doesn't matter age, gender, improve their mobility.
I think going back to what we were talking about, potentially sitting on the ground more, or like basically just changing up the position. So sitting on the ground, deep squatting, that kind of thing. You can move your work setup. Some people can. If you're working on a laptop, you can like go to the coffee table, sit on the ground, use a chair, deep squat. and you can still continue to work. You don't have to always be just sitting at your desk or sitting in one position. It's the variety that will help.
Okay. And with kind of going off of that a little bit, what is, in terms of maybe mentality along with that, what's one thing we can kind of remember to do or try to do a little bit better in our daily life to protect us physically or to help kind of our longevity later down the road?
Just movement, diet, essentially, probably. So getting it into and out of different positions, add something going in the opposite direction, being a little bit more intentional about that, I would probably say. You can use a timer, you can just pair it, you can like have it stacked basically. So if you have a timer, you can use that, or if you're like getting up to go do something, maybe every time you get up to go to the bathroom, you do a stretch, or you take an extra lap around, or maybe you do 10 deep squats or something like that. You can pair that with something that you're already doing.
And I think
into your daily life.
Yeah, I like what you said about the like opposite side, like counteracting something that you're doing, because like what you were getting at is, okay, if we're stationary, we have to counteract that by some sort of movement. And it can be little, it can be a couple lunges to the bathroom, right? It doesn't have to be like this massive thing, but also with just like how I'm sitting crisscross applesauce, I always put my left foot under my right. So simply just swapping that too, because now like the dexterity in my left hip is greater than my right. It's tighter, so I don't like the right foot under the left. But it's simple things like that. How you're sitting. Are you leaning more towards one side? Counteract by the other side. Are you always carrying your baby on one side? Switch it up. Just simple movements like that too, I think can help, because I know I'm bad at that. Yes.
I have a question.
For me, ask her.
Okay, I'm going to ask her, but I want to let you know that I have a question. Okay, so Dr. Laura, you've brought up a movement diet. So like a nutritional diet has proteins, fats, carbs, fibers. What are the key components of a movement diet? And I think you've already said a couple of them. So
good question. That was a good question.
So there's a couple different ways that you can go about it. You can go in like fundamental movement patterns. You can also go into like types of movement. So types of movement: strength training, mobility training. So the mobility training is your flexibility, your joint mobility. That can even include neurodynamics, which is basically like how your nerves move. And then you can also go like cardiovascular. Kind of generally speaking, those are categories of movement. And then you can go to fundamental movement patterns. So like your squat, your lunge, your push, pull, carry. And then like being a little bit more specific with upper body: vertical push, vertical pull, horizontal push, horizontal pull. And then like with the spine, rotation, side bending, all of those types of things, just including some of those different movements. Those are probably the categories.
that sounds like
There's multiple ways to take it. There's a lot of things, but generally speaking, trying to create as much diversity in your movement as you can.
I like it. Well, we are going to continue our conversation with Dr. Laura on our next segment. So make sure you stick around and tune in for next week. If you have any questions for the Discovery Doc or our guests, please let us know. You can ask us a question on the discoverydoc.com/podcast and leave us a voice memo. And we will definitely have Dr. Laura back on in the future for a Q&A when we have all that set up. So if you're enjoying this conversation, be looking for her again in the future.
This Thanksgiving season, we invite you to join us in expressing gratitude and thankfulness. Share with us what you're grateful for, and let's celebrate the abundance in our lives. Here are 2 ways to participate. Get your submissions in by November 21st. Number 1, leave us a voice memo. Visit the Discovery Doc website at thediscoverydoc.com and navigate to the podcast page. Record and submit your voice memo sharing what you are thankful for. Number 2 is send us an email. Compose an email to info@thediscoverydoc.com detailing the things in your life that you're grateful for. We'd love to hear from you. By sharing your gratitude with us, you're not only spreading positivity, but also inspiring others to reflect on the blessing in their own lives. Thank you for being a part of our community and for celebrating the spirit of Thanksgiving with us.
Let's shift our focus to the Toxin Tamer feature, where we'll explore the nitty-gritty of how to effectively manage and reduce exposure to toxins in our daily lives. Today's toxin to tame: BHA and BHT. Dr. Cece, what are these things? Don't make me say it, but she's going to. I know she is.
I was going to make you say it. I was like, have you been practicing your acronyms, AK? Because normally we get these all mixed up.
I do know them. I do know them. Okay, let me see if I can say them. Butylated hydroxytoluene and butylated hydroxyanisole.
Girlfriend, that was so good.
Yay.
Yes. A+ or AK. So yes, BHA and BHT, unfortunately, these are very common ingredients that we can find. There are synthetic antioxidants that are used to basically prevent anything from spoiling. So they increase our shelf lives by stopping the fats and oils from going rancid. So, you find these in products, which we'll talk about a little bit next time, but because they extend the shelf life of products, we find these lining our grocery stores all the time. BHT is a synthetic chemical that is made from reacting P-cresol or cresol. I don't speak science, so here we go. Cresol and isobutylene in an acid catalyzed reaction. That P-cresol, so that one part of this reaction is derived from coal tar or petroleum or just a synthetic process in general. After that reaction takes place, the product is then washed with sodium hydroxide and crystallized. So lots of problems there, obviously, is that then you are consuming a byproduct essentially of coal tar or petroleum. On the other hand, BHA is made by reacting various chemicals together, one of which is TBHQ. TBHQ is a synthetic preservative on its own that is known to cause cancer. It harms our immune function. It can mutate our genes, our genetics, and can negatively impact our cells. So again, that on its own is a reason to avoid this chemical in the first place, but we'll talk about more consequences that BHA on its own can have as well. There is a maximum allotted amount per our products in the United States, and that is 400 milligrams per kilogram of both BHA and BHT.
That's too much.
It's too much, girl.
That's way too much. Oh,
Yeah.
okay. So I'm going to take all of her science jargon that she just gave us, and I'm going to break it down for you even more for us laymen over here. So BHA and BHT are the preservative. So not only is it a preservative itself to extend the shelf life of lipids and fats, but it also extends the life of other preservatives. So the longer that something can sit on the shelf and not spoil, the longer it sits in your body.
100%. You just nailed that. That was great.
I did homework.
That was so good. That was absolutely so good.
I was prepared. So next week, we are going to tap into where do we find this and where we're going to try to avoid it at most opportune places and make the switches where we can. So that's the whole goal for this month, is to dive into BHT and BHA so you can avoid it and not put it into your body, because it doesn't go anywhere once you put it in, right? It's kind of stuck there.
It's kind of stuck there. I mean, you have to do some major detoxing, that's for sure, in order to get it out, because we're talking about 2 ingredients out of thousands that we're exposed to on a daily basis, really. So, we say this all the time. It's not just about the BHT. It's not just about the BHA. It's about the bioaccumulation of all of these synthetic ingredients that we consume and that are in our personal care products. So it is really important to know what they are, how to avoid them, kind of our ditch and switch that we have at the end of the month, so that you can just be better prepared to take care of you and your family.
That's great. And we are going to continue this conversation next week. So staying up to date with the Discovery Doc podcast is easy. To ensure that you never miss an opportunity to tame toxins, take a moment to subscribe and enable notifications wherever you listen or watch our podcast. And we'll see you next week. Welcome to the medical myth busting installment, where we'll uncover the truth behind common health myths and misconceptions. Get ready to separate fact from fiction. All right, Dr. Cece, what is this week's myth that we are going to bust wide open?
This week's myth is that one dose fits all. And we're talking about prescription drugs here. So prescriptions for a drug tend to be really, really generalized. There are, of course, certain guidelines, and they differ between pediatrics and adults. So we're kind of sticking to the adult world here, but some certain guidelines have to do with weight, duration, frequency, route. But if we just stop for a second, when we're thinking about adults, so with kids, you always take into consider weight. You always take into consideration weight. For adults, at some point, that kind of stops. And what we don't take into consideration is that synthetic drugs that target specific illnesses don't always work the same for individuals. We're all individuals. We all have different genetics. We all have different exposures. We all have different toxicity levels. We all have different methylation panels and our ability to metabolize drugs and just our environment in general. And most doctors ignore that individuality. We're kind of clumped into the same category of, oh, okay, this is a mid-30 adult female. And so we are starting with a dose of X, 20 milligrams of whatever it is. And if something's not working right, or if that drug is not responding in the way that that physician would like it to, then usually the answer is to increase the dose until it gets to a certain point, and then we might switch the drug. So if a patient, and also then if a patient experiences side effects from that drug, we usually just add another one to mask the side effects of that first medication. This is huge because even according to the American Medical Association, so the AMA, there's variation in individuals and how we absorb and metabolize any prescribed drug that can range from 400% to 4,000% difference in the dosage required between one person or the next. There was a former director of the FDA, his name was Carl Peck, who was quoted by the New York Times in 1999, and he said, quote, "One dose fits all is a marketing myth, but it's the holy grail that every drug company tries to achieve." Why? Because it's easy. It's easy for you to come into a clinic and say, hey, I have X, Y, and Z going on. Okay, here's again 20, 50 milligrams of whatever it is, and you're out the door. It's very easy to do that. It's very easy to implement that. It's not individualized whatsoever. And so a really, really good example of this is Prozac. The starting dose for Prozac is 20 milligrams. And so again, it doesn't matter really if you are a 125-pound woman who's 5'4", or a 250-pound man who's 6'4". We are starting at 20 milligrams, and that is quote unquote a low starting dose. But for that woman who's 125 pounds soaking wet, that might actually be too much for her. And in a study conducted by the Journal of Clinical Psychiatry, 85% of Prozac users suffered from diarrhea, 70% profuse sweating, 50% gained weight, all because that starting dose, that quote unquote minimal starting dose of 20 milligrams, was too high. Why? Because again, we metabolize drugs differently. Our genetics are different. Our predispositions are different. Our environmental exposures are different. Our abilities to detox are different, not just our weight and body composition. So that is something that is absolutely false. There are so many other considerations that need to be put into play for us when we are actively prescribing medications to humans.
So why don't we, okay, so we all know this when it comes to the drug of alcoholic beverages, that the same 125-pound woman may have a glass of wine in one shot and be schnockered. And then the same 250-pound man can have the same and he's not even buzzed, but he can have 4 shots and 2 beers and get his buzz. But if she drank it, that she'd be on the floor, blacked out, passed out. So how do we know, why do we know that that's okay? I mean, not okay, but we process in our brain that, hey, this is not like, there's a difference here. Like when it comes to alcohol, but not when it comes to Tylenol. That blows my mind.
Yeah. And there's so many good points there. Number one is right, over-the-counter medications. I'm over here talking only about prescription medications, but over-the-counter medications, every single one, Tylenol, ibuprofen, whatever it might be, allergy medication for adults, it all says what to take as, a starting dose and what not to exceed. That is so different from one person to the next. Another great example is anesthesia. If we, when I was a kid, I was 16, I had knee surgery, I metabolize anesthesia very, very fast. It's something genetically that it's again, part of my genetics. So I remember coming out of that surgery for my knee and the doctor, the anesthesiologist being like, wow, I had to give you the same amount of anesthesia as a 50-year-old man. And he was like blown away, but he's there by your side, adjusting the dose based on how you are metabolizing it, based on your vital signs, in real time, adjusting that dose. And for me, that's a lot, or that seemed like a lot at that age. And then if you had another, 16-year-old girl, they might have only needed a tenth of that dose. But in terms of anything else in our society, over-the-counter medications or prescriptions, none of that is even a thought.
That's insane.
Wild.
Totally insane. We measure for our children, we measure for our pets. I mean, my dog is on medication and they weigh her every time she goes to the vet and adjust her medication. She doesn't change that much in weight, but if she did, they would adjust her medication based on her weight, because too much would be too much for her little body. Like, that's just, and we don't do that for adults. So how do we approach this? I mean, this is the myth, right? That one dose fits all. We know it's not true, but how do we proactively navigate going through over-the-counter medication or advocating for ourselves in the prescription space when it comes to talking to our healthcare provider?
So in a perfect world, which this is not a perfect world, but I'm going to say that for people who have maybe someone who can run this for them. There are actually really good genetic tests that can be done, especially if you suffer from certain mental health disorders and you need to be put on antidepressants or SSRIs for anxiety or depression. There are actually really good genetic tests that can show what drugs you are actually able to metabolize and the ones that you are not. And there's certain companies out there who will do that. And we can link that in the show notes. But that's a really good starting point, is to understand your body. That's something that you can advocate for, to your healthcare professional and say, hey, I know that there's certain tests that look at, genetic markers to tell me how I break down certain medications and what medications are better for me than others. Can I get that done? That would be my utopia. Now, not all drugs are on there. And so at the end of the day, I'm a firm believer that we need to be so in tune with ourselves and trust ourselves that if something doesn't feel right, then chances are it's not right, because there isn't one, test to look for every single over-the-counter medication out there and every prescription drug out there. But if you start something and, let's use Prozac. Let's say that you start on that 20 milligrams of Prozac and you feel like it is not a good fit for you. Trust yourself. Trust yourself. That's the best advice that I can have. And at the end of the day, you are the captain of your ship. Nobody knows your body like you do. I don't care if someone comes around and says, oh, hey, this is really normal. Like, give it another, 2 months. Okay, 2 months goes by and you're still feeling it, but your quote unquote anxiety is better. Then it's not good for you. Trust yourself.
That's great advice. I think we can all approach anything with that mentality. And also, is it okay to ask our doctor to do a medication based on our weight?
Yeah.
Can we ask that question?
Yeah, you can. Or you can even ask, based on these are things, I don't encourage you to have to go this far, but these are things that you can look up too, in terms of in doctors' minds, there is a starting dose for everything. But if you feel like you are somebody who metabolizes drugs quicker, which honestly you can get kind of an understanding if you do drink alcohol, how quickly do you metabolize that? Are you somebody who, and they're such apples and oranges, but it's just data points, right? So if you're someone who metabolizes it really slow and you're highly impacted by just one drink, or you've had a surgery before and you're really, knocked out from anesthesia very easily, then chances are you're a really slow metabolizer of other drugs as well. So you can also approach your physician or your doctor or healthcare provider and just say, hey, I understand that this is the starting dose. Is there any way we could start lower than this, just to see? I understand, to them, they'll say, well, there's no literature that proves that it's effective at this low of dose. Okay, but it's my body and I'm comfortable with starting a little bit lower. We can always move up. So that's a conversation. My hope would be that you have a provider who's just open to communication, and just having that conversation with you. And if it makes sense in that certain situation, then it makes sense, and it might not. And then they'll tell you that it doesn't. But absolutely, I think you should never be fearful to ask.
Great. We will continue this conversation and bust myths again next week. So make sure you join us again next Thursday. And until next time,
Let's discover together.
We'll get it. Yeah, we're going to do this. We're not in the same room. It's hard.
We're not. It's hard
be
to do this
patient with us.
together.
But if you want all of Dr. Cece's top picks and swaps for the season in your inbox, join our mailing list at thediscoverydoc.com and become an insider if you like being part of the party and getting special invitations. Thanks for tuning in to another episode of the Discovery Doc podcast. We hope you found this week's deep dive into mobility, preservative risks, and medication myths as enlightening as we did. Want more insights on living a non-toxic life and maintaining your well-being? Be sure to join us next week as we explore new health mysteries, bust some more myths, and continue the conversation with Dr. Laura. Remember, your health journey is unique, and we're here to help you navigate in every step of the way. Until then, stay curious, stay healthy. We navigate the vast ocean of health information. Let's pause for a brief disclaimer. The content of this podcast is intended for general, informational, and entertainment purposes only. While we're thrilled to be your Discovery Doc crewmates, we're not here to replace your doctor or healthcare provider. Think of us as your fellow sailors on the journey to better health, sharing our knowledge and experiences. Remember, always consult a qualified medical professional before taking any action based on the content of this podcast. Like a sailing adventure, this disclaimer may change occasionally, so be sure to check back for updates. Stay healthy, stay curious, and keep sailing with the Discovery Doc.